For healthcare workers, and I want to hear from healthcare workers today, particularly those working with, as Fiona talked about there, the elderly and the vulnerable and healthcare workers in nursing homes in particular, because I'd like to understand why you don't want to get the COVID-19 vaccine, particularly given the occupation that you're working in. It's 1890 453 106. Fiona, stay with us, because Alison Woods is the Director of Nursing at the Aylesbury and Ashbury Nursing Homes in Dublin. Alison, thanks for getting in contact with us here in Lunchtime Live. What do you think?
I'm nodding my head. So good afternoon, Andrea. Good afternoon, Fiona. I'm nodding my head in complete agreement to everything that Fiona has said. And I suppose just first and foremost to offer my really most sincere condolences to you, Fiona, and the loss for yourself and your family. You're very right. You shouldn't have had to go through that. And to have your mum with 10 mourners at her funeral, it's not right. It's not the way it should be. And I think that healthcare workers, particularly in the front line, they should be mandatorily vaccinated. I'm in complete agreement. I really am.
So you think that, for instance, all of your staff in the Aylesbury and Ashbury nursing homes, they should have to get the COVID vaccine?
I do. I really do. We had a good uptake, but in my view, it could have been better. So just to give you the numbers from our perspective, we've about 170 employees, and in total, 36 have opted not to get the vaccine. There is further opportunity for them to change their mind in the coming weeks, but I suppose there's fear from some of them anyway, fear in relation to the unknown long-term effects. Some of them would be hoping to have children in the next year. One is pregnant at the moment. So some of them, I would say, are kind of valid from that perspective, but others have had their children, you know, they're frontline nurses. I genuinely believe that it should be mandatory. I mean, training as a nurse, you have to have hepatitis B vaccination.
Yeah.
It's part and parcel of the role that you've taken on. And yeah, I will fully support it. So I can't really defend anybody who has decided not to take it when they're in the front line.
Alison, can I ask, is there anything you can do? And I understand people have the right, you know, to choose to say yes or no, I don't want to receive the vaccine. And I know there's, you know, obviously we have our legal framework in and around that. You can't make anybody have to get the vaccine. But for, like, if you have, you know, parents or family members that maybe have a loved one or a resident in one of your nursing homes in Aylesbury and Ashbury, can they decide, you know, Nurse Andrea doesn't have the vaccine, I don't want my loved one or my family member or my parent being in contact, you know, with that particular nurse because she's not getting it? Like, does that come up to family members?
It hasn't yet. We've just had our second round of vaccines last week, so that hasn't arisen. But in practical terms, it would be extremely difficult. So you might have two nurses on at night, and if they're working in close contact with each other, I mean, with the vaccine, we don't know if you can pick it up and transmit it, even if you've been vaccinated, you know. So COVID could still enter a nursing home and be passed. I mean, the theory or the science hasn't actually proven that it can't be passed on, even if you've been vaccinated. So practically, it would be very difficult to absolutely confirm that just because nurse A has been vaccinated, nurse B hasn't, that you could still protect all residents, you know, and even sort of taking nurses or staff off the front line back into, we'll say, non-patient facing work. It's not practical because 80 or 85% of our staff are patient facing.
Well, this is the thing. I don't understand that argument about the non-patient facing work, and I know it's happened in other hospitals, because there's only so many jobs, administrative jobs, that people can do. You can't just create the work out of nowhere.
You can't, and if especially in a nursing home where, like I said, 85% of the staff are patient facing, there's nowhere to redeploy a nurse manager, for example. You know, I just think that it should be brought into legislation, to be honest with you, or people should be asked to find alternative employment within, you know, the legal framework.
So you think you actually think, as a director of nursing in a nursing home, there should be legislation, all healthcare workers in nursing home settings?
Yeah, I do. I mean, at the end of the day, I mean, how has COVID gotten into nursing homes in the last, we say, 6 months? Visiting has been completely restricted. It's not a blame game, and it's not intentional, but at the end of the day, it's been brought in by staff. So how do we stop it? We vaccinate staff. We can't keep residents locked up and away from their families. It's inhumane. It's not right. And I do think that people, they've chosen a healthcare profession. So it goes with it that, if you're an accountant, you have to do your exams. If you're a nurse or you're a healthcare worker, you have to take your vaccines to prevent, passing on illness to a resident or to a patient. It just goes with the territory, I think.
Anna, who is a healthcare worker, has got in touch with us here in the News Talk text line in 53106. No mandatory vaccines whatsoever. How dare it even be considered? Most vaccines are still on trial and some until 2023. Another listener got in touch as well, a healthcare worker, who says they absolutely don't want to get the vaccine, concerned about it, and they don't want to be forced to get it either. Like, when you talk, Alison, to staff, within your own nursing home settings, is it a tough conversation to have with staff, or is it just a...
Well, we've done everything sort of from an employer's perspective to try and entice staff. We've had, raffles. We've offered €1,000, but in cash prizes.
You even have to go down that.
Yeah. There's been a huge PR campaign. Now, whether that was the reason they took the vaccine or not, we wanted to make sure we did everything that we could in order to encourage everybody as much as possible to take it. So we have gone down the route. We would have staff accommodation, and something that we can do is obviously protect the employees living in the accommodation. So staff who weren't willing to take the vaccine were asked to find alternative accommodation. So, that's a way of protecting our staff and protecting the residents. And over the last year, anybody who's in the nursing home operating business, the cost mentally, not only to us, listen to Fiona on the other side of this, to families, to residents, to staff themselves. We can't keep going like this. People will be completely burnt out, and we have to do everything we can in order to keep COVID out going forward.